Worry is a universal experience. We all worry. Men worry, women worry, uh, elderly people worry, young people worry, rich people worry, poor people worry. Everybody worries. And the thing is, we all tend to worry about the same types of things. We worry about work or how school is going. We worry about our finances. We worry about health and well being. We worry about our relationships, romantic relationships, friendships. We worry about our social interactions. We worry about community and world affairs. And we can even worry about minor matters like things like punctuality or getting chores done around the home. And the thing is, we all worry about these types of things from time to time. So the fact that you worry isn't a sign of pathology. It isn't a sign that something's wrong because everybody worries. This is the start of a multi part video series examining the concept of excessive worry and generalized anxiety disorder. And in this process of this video series, we're going to be talking about ways of better understanding what happens with excessive worry and generalized anxiety disorder. And we're going to be talking about tools and skills that a person can use to manage and cope with excessive worry. Now, the thing is, sometimes people will think about worrying kind of like checking a tick box. Am I a worrier or am I not a worrier? But the thing is, worry isn't this binary thing. It sort of falls more on a continuum where there's people with very low levels of worry and there are people with very high levels of worry. And we all fit somewhere on that continuum. Now, my guess is if you're watching this video, chances are you're probably a little closer to or gravitate more towards the high worry end of the continuum. And for people who worry excessively, for people who can experience difficulty controlling their worry, they can sometimes end up having a condition that we call generalized anxiety disorder or GAD. So they tend to be the people that are on the very end of this continuum. But there's also a group of people who may not meet full diagnostic criteria for generalized anxiety disorder, but they do tend to worry more than they would like. And the same tools and skills that we're going to be talking about in this video series that we use to manage worry and generalized anxiety disorder, these tools can be used to help people manage high levels of worry, even if they don't meet that full criteria for GAD. Essentially, these tools can be used for any worry for anybody who falls anywhere along this continuum. So, we've introduced this concept of worry and generalized anxiety disorder, but what is generalized anxiety disorder exactly? At its core, generalized anxiety disorder is associated with chronic, excessive, difficult to control worry that's associated with a variety of physical and cognitive symptoms. And these physical and cognitive symptoms include things like high levels of muscle tension, feelings of restlessness, or a person constantly feeling on edge, kind of like this nervous energy, fatigue, difficulty sleeping, problems with irritability and just being a bit more snappy, and concentration difficulties. And some quick facts about generalized anxiety disorder. About 5% of the population will experience generalized anxiety disorder at some point in their life, and 3% of the population will experience generalized anxiety disorder in any given year. So, at least 1 in 20 people will meet diagnostic criteria for GAD, and that puts them on that very far end of that worry continuum. But even for people who don't meet that full criteria for GAD, there's lots of people that probably tend to worry more than they would like or would like to have more control and ability to manage their worry. So, excessive worry is a very common thing. Two-thirds of people with generalized anxiety disorder are women, so it's more common in women than men. And some people will develop generalized anxiety disorder in childhood. And these people often say that they've been a worrier their whole lives. And other people, they will develop generalized anxiety disorder, later in adulthood. But this late onset, sort of adult onset, generalized anxiety disorder, this tends to occur usually following a major stressful life event like an accident or a major stressor in their life, divorce, loss of a loved one, that type of thing. Now, because the worry and generalized anxiety disorder is so chronic, and people tend to experience this chronic excessive worry, people with GAD tend to assume that worrying is just a part of their personality and it's something that can't be changed. And this can be one of the primary reasons that people don't seek help for their generalized anxiety disorder. They just assume that it's part of who they are and there's no point in seeking help because nothing's going to change. And that's a big problem because GAD is very, very treatable. Now, over the course of time, generalized anxiety disorder tends to wax and wane, and it can worsen during times of stress. But even at times when things are going well for a person, people with GAD will still be able to find something to worry about. They're very, very good worriers. And because generalized anxiety disorder is associated with physical symptoms, it's very, very common that people with GAD will often see their family physician or doctor, or they'll make multiple medical appointments because they experience vague physical symptoms, things like headaches, upset stomach, fatigue, and just a general sense of malaise. And they go see their doctor does all sorts of tests, but can't find anything medically wrong that's causing the symptoms. And this can then just contribute to even more frustration and even more worry because the person with generalized anxiety disorder thinks that there might be some physical cause, but nobody's finding the physical cause. So they start to worry about what exactly is going on. So, uh, the worry and generalized anxiety disorder differs from your regular, typical garden variety worry in a number of ways. So the worry and generalized anxiety disorder tends to take up a lot more time. It's much more time consuming, and it can take up significant chunks of a person's day. So it's not uncommon for people that I'm working with generalized anxiety disorder to say that they worry, yeah, 30, 40, 50, 70% of the day is spent worrying about something. Um, the worry and generalized anxiety disorder tends to be more difficult to control. It's hard to stop once you start worrying, and the worry gets in the way of trying to focus and do other things. I refer to the worry and generalized anxiety disorder as sticky worries, that once you start to worry about it, those worries get stuck and it's hard to break away from them. The other difference between generalized anxiety disorder and your garden variety worry is that worry in GAD tends to be more pervasive. And what I mean by that is that people with generalized anxiety disorder tend to worry about a lot of different topics. And this is different than people who just worry about their finances or worry about their relationship that may not be going well or worry just about sort of their social interactions. Worries and generalized anxiety disorder tend to span the gamut of a whole bunch of different topics that people worry about. And sometimes the worries in generalized anxiety disorder tend to be more out of proportion to what's actually going on. There's much more worst case scenario building in generalized anxiety disorder worry than your typical garden variety worry. And as I mentioned earlier, the worries in GAD tend to also be associated with physical symptoms, things like the restlessness, fatigue, muscle tension, sleep problems, that sort of thing. Those tend not to happen as much or as intensely with people who don't have GAD types of worries. So notice it's not the content of the worry that differentiates GAD worry from your regular garden variety worry. It's more the intensity and the chronicity of the worry that is the differentiating factor. So it's not like people with GAD worry about really bizarre things. They worry about the same things that everybody worries about. They just worry about them much more intensely, much more chronically, and worry about much more types of things. So, with that understanding of generalized anxiety disorder, some understanding of sort of the continuum nature of worry, what I want to talk about now is a basic model to understand how worry happens. And so it's really important to understand that this is just our initial model of worry. As we go along in this video series, we're going to be adding lots of components to this model. So you can just think of this as the bare bones engine of worry. And a- all worry usually starts with some sort of trigger situation. And triggers can be anything. They can be external triggers, they can be internal triggers. So, an example of an external trigger is my wife is late coming home from work, and I start to think to myself, "Oh, what's wrong? What's going on? What if my wife has been in a car accident?" That's an external worry. Sorry, an external trigger. Internal triggers are things like I've noticed that I've had a stomach ache for a few days, and I say to myself, "Oh, what's going on here? This stomach ache isn't going away. What if I have cancer? What if this is an ulcer? What if this is something really serious?" So you have this trigger, whether it's something external that's happened or something internal. And the trigger leads to what I call the what if question. People who worry a lot tend to be really good at generating these what if questions. They tend to have more what if questions, and it's easier to get stuck on these what if questions. So, the examples I gave, what if my wife's been in a car accident? What if I have stomach cancer? So, uh, you get this what if question. It typically isn't the case that you just stop at one what if question. So I don't get the thought of what if my wife's been in a car accident? I wonder what I'm going to make for dinner. It doesn't usually work that way. So it's usually that one what if question leads to another what if question, which leads to another what if question, which leads to another what if question. Or it can be the same what if question looping over and over and over and over and over again. But it's this chaining and spiraling of what if questions that leads to worry. And so worry is this chaining or this sort of this repetitive what if questioning, often leading to imagining worst case scenarios. What if my contract at work doesn't get renewed? What if that means I won't be able to pay my bills? What if that means I'll go into debt? What if that means I'm not going to be able to pay my mortgage? What if that means I end up homeless and alone? So you see, it's that chaining and spiraling of these what if questions that can lead to imagining these really awful worst case scenarios. And if you're constantly having a bunch of these negative what if questions that spiral down into these horrible worst case scenarios, what emotion do you think that that's going to bring up? How do you think that's going to make you feel? Well, typically, the result of this what if spiraling into worst case scenarios is anxiety. That people are going to feel anxious if they're thinking about all these awful things that can happen. And so, anxiety is the emotional outcome of the result of the thought process that's worry. And so imagine yourself going through this process over and over again, day after day after day. Trigger, what if worry anxiety? Trigger, what if worry anxiety? Trigger, what if worry anxiety? How do you think you're going to feel by the end of the day? Well, for a lot of people, they talk about feeling demoralized and exhausted. And the person feels demoralized because all they're ever thinking about is all of the negative things that are going to happen. It's hard to feel excited or enthusiastic about anything because you're always thinking about the negative things that can occur, and that can be really demoralizing. And exhaustion on a couple of levels, both physically and mentally. So, mentally, because your mind won't shut off. It's constantly thinking about all of these things that could go wrong, but also physically exhausting because these high levels of worry can lead to those physical sensations I was talking about, the muscle tension, the physical restlessness, the difficulty sleeping. And so The more exhausted and demoralized you feel, what do you think that does to the frequency of what if questions? Well, you end up having even more what if questions. And so this leads to one of those vicious spirals that's very common for people who worry a lot. And so this is our basic engine, our basic model for understanding worry. And this is the starting point for our series on worry management skills. And in the next video, we're going to be talking more about what worry is and two main different types of worry. And when I've uploaded that video, you're going to be able to find it right here. So that's all for today's video. As always, thank you for making it all the way to the end of this video, and I will see you in the next one.